Okay, well, welcome to the Spine and Performance Institute, Francisco. For everyone who's watching today, maybe perhaps you can tell us a little bit about your journey. What brought you here?
Absolutely. So I'm from the Washington, D.C. area, so about 3 hours away. And I've been having back problems on and off for the last 10 years. So I've been able to manage it, and I would get an episode maybe once a year, which would mean I was out of every activity for about a month each time.
Mm-hmm.
And in the last year already, I had already had 3 different episodes. So I was already out for 3 different months throughout the year. And these would happen when I'm traveling or, in different circumstances. So very hard to plan your life
Of course.
around things like that happening. So that's when I decided to proceed with the surgery.
Yeah, I was going to say that what held you back from undergoing surgery?
Prior to that,
Yeah.
the advice I had gotten from the doctors that I had seen was try and defer the surgery as much as possible because new techniques are always being developed, new procedures.
Right.
So 10 years ago, maybe this would have taken much longer to recover.
Yeah.
So their advice was, if you can live with it, try and live with it as long as possible,
Right.
and let new technologies come.
Yeah. And that's what I tell people all the time is that maybe 10 years ago surgery was different.
Right.
But now with our newer techniques, that it's really not that big of a deal. And you had undergone our whole rapid recovery spine surgery protocol, right?
Yeah.
Why don't you tell us a little bit about how that felt for you?
Yeah, so I had surgery a week ago, and literally got up, walked 20-40 steps maybe a few hours after surgery.
Yeah.
And then got in my car, and my wife drove me back home to DC.
It's incredible.
So it was
Absolutely.
unbelievable. And then have been, following all the, taking all the different supplements, twice a day, both pre and post op.
Absolutely.
And have been doing a lot of just walking on my treadmill. I think I hit 4 miles maybe a day ago.
After surgery.
After surgery.
Yeah, and I know
within the first week.
We went over that you've been hitting basically about 10,000 steps, but part of the problem that many people have is that after spine surgery they have a lot of pain, right? And they just don't recover well. So we developed this whole rapid recovery protocol to help with that. I know you alluded to this earlier, but tell us, so a week before surgery, we did the IV infusion.
Did the IV infusion here at the office,
And then you took the supplements for about 7 days.
That's right.
And how was that for you?
It was fine. I would the flavor was actually okay. It's not that I was jumping up and down to go drink it, but I did mix it with fruit smoothies and other drinks just to kind of dress it up.
Sure.
And it was fine. And I've continued that. I also did the carbs the night before the surgery.
Right.
And I had been warned that the smell of that one is very powerful. So I actually drank it in a cup with a lid and a straw, and I didn't even smell it. So I couldn't tell you if it was good or bad.
Yeah, I think that many people don't realize is that surgery is a big event, right? And then to some degree you have to get your body optimized for surgery.
Right.
Just like you would if you were running a marathon.
Right.
And that's what we're trying to do with our whole rapid recovery protocol.
Interesting.
But then one of the things that many people talk about also is that how painful spine surgery is. And many people are really afraid of taking narcotics.
Right.
So what was your pain management regimen after surgery?
So after surgery, I basically just kept it to ibuprofen and Tylenol.
Great.
And just switching back and forth every 3 hours between the two. And did not, even though I had prescription narcotics available to me, if the pain got to that level, it never got to that level.
That's perfect. And I think that's all part of it too, because nowadays we know that narcotics can give you constipation and give you all the other problems, but it all leads to this rapid recovery.
Yeah.
So now you're about 7 days from spine surgery, from a spinal fusion surgery.
Yeah.
How do you feel?
I'm feeling pretty good. I took the train up this morning. I'm about to take the train back to DC this afternoon.
Absolutely.
And, feeling pretty well.
Okay.
So.
Well, glad we're really happy, obviously. We're happy that you can come up from Washington, D.C. for the spinal fusion surgery and then go back, so that's great to hear.
Absolutely.
Okay, well thank you, Francisco.
Thank you, doctor.
I appreciate
All right.
it.
Yeah.